Hi, my name is Dori Kleesis, and I'm with the Mount Sinai Health System. Today I'm with Dr. Fred Hirsch, who is the Executive Director of the Center for Thoracic Oncology at the Tisch Cancer Institute at Mount Sinai. He's also a professor of medicine at the Icahn School of Medicine in New York. Thank you so much for joining us today.
Thank you.
So you work with patients with lung cancer. What are you seeing? Are the rates rising? What's the status now of patients with this condition?
It is definitely too many of them. We see a slight decline, but still it is too many patients with lung cancer. Lung cancer is the most frequent cause of cancer death. It is 225,000 new cases every year. And unfortunately, we see a rise in the younger patients, never smoking patients. So there is a lot of work to do.
And what's the field like? How are we treating these patients that come in to see you?
So fortunately, we have seen over the last decade tremendous progress in treatment of patients with lung cancer, particularly patients with advanced lung cancer, what we call metastatic disease. And most of the lung cancer patients have an advanced stage when they are diagnosed. So we have seen over the last decade a tremendous progress in treatment, mainly due to what we call molecular targeted therapies, and most lately over the last few years, immunotherapy.
So the molecular target, do you actually take the cancer and send it to pathology and find out what mutations there are so you could target with the drug?
Exactly right. And that is why it is so crucial that all patients get what we call a molecular characterization of their tumor. And today we have, the technology has developed also. So today we have technology which can detect a large number of mutations. Not all those mutations have approved drug connected to them. But beyond the approved drug or approved drugs, there are a lot of clinical trials for new drugs. And it is important that the patients get this knowledge and can seek clinical trials if there isn't a current approved drug.
And what's the role of immunotherapy in treating these patients?
So immunotherapy has rapidly come into the scenario. And here, lung cancer has been a role model for a development of immunotherapy. And immunotherapy has initially been tried and applied in patients who have previously failed conventional chemotherapy. And now we are starting to see long-term results from those patients. And the latest data we have seen is by using single agent immunotherapy, we can now see 5-year survival rate around 25%. That is a group of patients who 10, 15 years ago would have a survival of 7 to 9 months. Now, these days, we are trying to combine the immunotherapy, either with other immunotherapies or with other drugs, chemotherapy or targeted therapies. And I'm sure that will improve even more the results, but we don't have the long-term results yet on that. But that is probably the future.
I'm wondering if you could take us from a patient coming in with lung cancer. What are the treatments, very briefly? First, you try conventional chemotherapy, then you try this. Can you give us a small description of that?
So today, molecular characterization is important. If they have specific mutations which can be targeted with specific drugs, those group of patients are treated initially with those specific drugs.
Very good, very good. So that's hopeful. You have a target.
You have a target.
And if you don't?
If you don't have a target, today you will offer those patients immunotherapy. And mostly as a single agent, if they have a high concentration of those receptors. If they are low, you need to combine it with chemotherapy.
Excellent.
So that is the treatment for patients with advanced disease.
And immunotherapy, is it a drug? Is it a vaccine? How do they get that?
Checkpoint inhibitors are a drug that is infusion, and it can be every third week, every second week, every fourth week. It depends on. But vaccines are under development. They are not for lung cancer yet approved. So this is not a clinical care thing. It is
not yet, but
not
coming,
yet.
hopefully.
Hopefully
Yes.
it's coming.
Another
and Mount Sinai is certainly
is a leader in the field.
leader in the field.